health clinic. So Sam's been a patient of ours for a couple of years now.
Absolutely, probably longer.
So what made you get in touch with the Women's Health Clinic regarding your menopause care?
Oh God, where do I start? I went from being it made me cry actually. I went from being a normal, happy, positive human being to somebody that didn't want to leave the house. And it happened quite quickly. It really is making me, I know it is. It really, so I was trying, I couldn't sleep, I couldn't eat. I felt like I've never felt before. It's never been the sort of person that I am. I've, you know, if you ask anybody that knows me, I've always been the most positive person. And all of a sudden, my life just turned upside down. And I looked for everything, and then all of a sudden, I thought hormones, my age. You know, I just thought there's got to be some reason for this. So I then contacted yourself when you put me in touch with the nurse. I'm really sorry, I can't remember, Katie. And she took my blood. Then I got a telephone call with my results and saying that my hormones were on the floor, basically. And then very quickly you prescribed, or Katie prescribed, patches for me, and for me, whether it was in my mind, whatever, very, very quickly, or having a answer to how I felt, or there was probably a reason, I then started very, very quickly to feel better. Whether it was the comfort of knowing that was what the reason and my hormones were so low, but you know, very, very quickly. I mean, for me, not wanting to leave the house is absolutely, you know, and I'm, you know, it's not that it's anybody else, but it was just not my personality. You know, I've always been very life soul of a party type of thing, and I just, you know, that was it. So
I think part of anybody that's not seen it before, but with our nurses, the menopause specialist, you get an hour. Do you think that's enough? Do you think that was part of the help as well? Mine was just, you know, the phone call, it was brilliant. You know, it was very black and white. She rang me and said, look, your hormones are extremely low. My testosterone was through the roof. You know, she explained that she obviously wants to get that down. And the fact that, you know, both the progesterone and estrogen were very low. You know, we discussed different types. In fact, to start with, if I remember now, I got put on the tablets, and I didn't like them. They gave me an instant headache by taking them. So I got in contact. She rang me out of hours, which was amazing. On a Friday evening, I was out having a drink, so I'd gone out, little drink, but I was out. She rang me, which I thought was amazing, not to let me go through the whole weekend, which was fantastic. She then prescribed me the patches, sent me over a private prescription. I then got that Saturday morning, and I started Saturday morning with the patches. So yeah, for me, the tablets didn't work. I wasn't very good at taking the pill when I was younger, whether that had anything to do with it, because it messed with my hormones a lot. But the patches, well, they're a completely different thing. So, and you know, I thought she was absolutely amazing. And you're under regular monitoring as well, so you know that you know in terms of the service that whenever you pick up the phone, you've got me. It's good now, I think. But if I'm not around, you've got the 0800 number, you've got the chat box as well, and if the nurses aren't available, then it will always default to
and email as well. Because Roslyn, is it Roslyn?
Yeah.
She is very good an email getting back. If, for instance, like you said, is, you know, there's the numbers and the helpline. Was it 0800 number? She's very good at communication.